Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. So this week's question is actually two questions, and if you're looking at the screen, you realize that the grammar's not the best, so let me change it just a little bit. What is the negative side of taking long-term birth control pill, like being on birth control for 3 to 4 years? What's the bad side effects? An oral contraceptive is a great option unless you have certain conditions like clotting disorders or high blood pressure that's not being managed. It's not a great option if you're taking medications that might interfere with its effectiveness, like certain anti-seizure medications. And it's a great option if you're not a smoker who's over 35. There are some really great benefits of using oral contraception, like a decreased risk of certain forms of cancers. And it makes your period way more predictable and the flow lighter if you choose to have your period. Now you're thinking, wait, choose to have a period? That's right, you don't actually have to have your period. How do you do that? Basically, when it's time to take the placebo pills, just skip them and start taking the next pack of pills. You should talk to your doctor before you do this. If for no other reason, then they're gonna have to change your prescription to make sure you get enough packs in a year. And by the way, if you do this, expect some breakthrough bleeding when you start it. But there are women who have gone years without getting their period by doing this. One of the big risks you hear about with the pills, it's possible linked to an increased risk of breast cancer. So is it true? Is there a link? Honestly, the answer is a bit inconclusive. A recent review of the research shows that there may not be any kind of increased risk of breast cancer for women who use the pill for less than 5 years or who've already had a full-term pregnancy. If you have a family history of breast cancer, or really you're just worried about the possible risk, make sure to have a chat with your healthcare provider. One of the great things about the pill is that it's reversible and something you can easily stop. And you can use it with condoms if you're worried about STIs. For some people who start using the pill, it can be a bit frustrating in those first few months as their body adjusts to the side effects, or they may go through a bit of a trial and error period as they try to find the right one for them. But all in all, most people who use the pill are happy with it. Until next time. Did you enjoy that video? If so, make sure to like it. Also, make sure to subscribe. It lets you know when new videos are coming out and it helps to support the channel. Check out the description for information on how to find me on Instagram and Medium.